The National Data Opt-out is a new service that allows people to opt out of their confidential patient information being used for research and planning. The RCGP has also carried out work to raise awareness of the National Data Opt-out within the primary care community. Patients, not clinicians, are responsible for setting their National Data Opt-out preference if they so wish. But it is important for GP teams to be aware of the National Data Opt-out and where to signpost patients should they ask about it in the practice. Furthermore, it is also important that GP practices are able to uphold the National Data Opt-out. All health and care organizations will be required to implement patients' National Data Opt-out choices by March 2020. Your practice handles large quantities of confidential patient information. That is information that is identifiable, provided in confidence, and includes information about an individual's physical or mental health. It is therefore your responsibility as a data controller to ensure that confidential patient information is stored and used in accordance with data governance legislation and policy, plus local arrangements as set out in the practice privacy notice. As well as individual care, data can be used for research and planning purposes so that we can improve the quality and standards of care we provide. It is important that your Caldecott guardian or responsible person for information governance understands how the National Data Opt-out will be applied where appropriate in your practice. Patients' National Data Opt-out choices are held on a central spine service. To apply the opt-out, a list of NHS numbers is submitted to the spine service, which will remove the NHS numbers of those patients who have requested an opt-out and return a list of the remaining NHS numbers. Usually this will take place within the GP clinical system, but sometimes it may be through a subsidiary system. You will be notified by suppliers when this functionality becomes available. As a practice, you must understand how the National Data Opt-out will apply to any information you are releasing for any purpose other than direct care. To support you with this, the RCGP has published a toolkit and e-learning modules to help you understand how it works and enable you to explain it to your patients. The toolkit provides a resource that can be accessed as required, with sections covering all the important aspects of the National Data Opt-out. The e-learning modules each take about 30 minutes to complete and will help you to develop an understanding of the National Data Opt-out and its implementation. Use of either of these resources is a useful addition for your appraisal and continuous professional development.